She is going to be joining us. Yeah, she's just logging in now.
Okay, that sounds great. Are we live?
Not yet.
Okay, all right.
Takes me a second to get logged into it here. Okay, we're live.
Okay, thank you. Welcome to our June 2021 board meeting. First order of business is oath of office for Jennifer Moff, conducted by Commissioner Bill Smith.
Good evening. Jennifer, which one on the Zoom? Ah, there you are. Okay, good. Are you ready?
Yes, I am.
All righty. Jennifer Moff, do you solemnly swear that you will support the Constitution of the United States and the Constitution of the State of Ohio, and that you will faithfully and impartially discharge your duties as a member of the Stark County Board of Developmental Disabilities to the best of your ability and in accordance with the laws and the rules and the regulations of the board now in effect and hereinafter to be enacted during the continuance of said office and until your successor is appointed? If so, the answer is I do.
I do.
Jennifer Moth, I thank you for your commitment to Stark County community, and I do hereby name you to the Board of Developmental Disabilities. Congratulations, and I want to thank you in advance for your service, your continued service.
Thank you very much.
It was an honor this evening to administer the oath, and I'd like to say to the board, thank you for your service and commitment to our community too. So, thank you very much.
Thank you, Commissioner Bill, for joining us and doing the oath of office. Yeah.
And we thank you for your service to the 380,000 people here in Stark County.
Thank you.
Yeah.
Enjoy it.
Thank you. Okay, well, first, congratulations, Jennifer. We're honored you're joining us, first as a parent, but also as an educator. Please know your feedback is going to be valued and appreciated as we make decisions for our 4,100 people and their families that we serve, and we give you a warm welcome. I don't know if I don't know if you can take a moment and tell us a little bit about yourself.
Sure. So, my name is Jennifer Moff. I am a proud wife and mother. I'm also a school principal. I am the wife to Alan Moff, my husband, and we have two children. Alex is our oldest. He's 16 years old. He receives services from the Stark County Board of DD. And our youngest is Kyle. He's 14 and he's going into 8th grade, playing baseball and hanging out with friends. So loving life as a 14-year-old. When I'm not being a wife and mom at home, I am the Avondale Elementary Principal for Plain Local Schools. I just finished my 3rd year working for Plain Local Schools. Before that, I was a teacher and principal in Akron Public Schools. So I'm thrilled to both live and serve in the community, in the same community. So that's just a little bit about me. I'm really happy and honored to be part of this group and to be able to serve the community in a bigger way.
Well done. Thank you. And thanks for joining us. All right, I'd now like to call the regular board meeting to order. Meeting called to order at 6:06. Roll call, Jim Anderson.
Present.
Dr. Falvo Lang is excused. Maria Higgy.
Here.
Jennifer Moff.
Here.
Carmelita Smith.
Here.
Cindy Sutter.
Here.
And Dan Sutter. Here. Okay, we move to in memoriam. to extend our sincere condolences to the families of the following people who have passed away since our last meeting. Patricia Patty Lynn Stovall. Patty, age 66, passed away Tuesday, May 11th. Patty attended TWI and participated in Beyond Our Boundaries. She received services from the SSA department. And Aiden Lee Rickman. Aiden, age 1.5, passed away Monday, May 10th. Aiden received services from the early intervention department. Let us have a moment of silence to honor their life and passing. Okay, thank you. I now need a motion to approve minutes from the regular board meeting held May 25th.
Hickey moves.
Second,
Anderson, second.
any additions, revisions, or corrections? With none, all in favor of approval of the board meeting minutes, say aye.
Aye.
Opposed, say nay. Any abstentions? Maybe Jennifer Moff may want to abstain.
Oh, okay. I
Yeah.
thought that was coming up at this
Yeah.
meeting, later in this meeting.
Yeah,
I'm
no,
sorry.
well, these were the minutes from the prior.
Okay, I
meeting.
apologize.
No,
I do
no
need
problem.
I do need to abstain.
Yeah, no problem. We have recognition of retirees. Bill will now share a brief PowerPoint presentation to recognize one retiree.
Bill, I think you're on mute.
Yeah, so we are just very proud to have Frances Mokadine as an employee. She has served 22 years for us. You can see her there with the art that she has been given on behalf of the board as recognition and appreciation for your years of service. She served as one of our high school teachers, and she would do literally anything for her students. She has agreed to come back as a teacher substitute, so she's saying goodbye, but when we're in a pinch, we know we can give her a call, and she's going to come back on an as-needed basis when teachers are out for whatever reason. So that just further illustrates her commitment to the students. So we want to express our appreciation, thanks to Frances, and we wish her well for her retirement.
Okay, thank you, Bill, and congratulations to Frances. We at this time will entertain anyone for public speaks. Anyone there for public speaks?
We did have someone scheduled, but they did not come. So maybe they'll come next time.
Okay, no public speaks. We'll move on to the president's report. Good evening again. Seems like June and December always have a packed agenda, and we've got no exception for today. Now, regarding Ohio legislation, if there are no changes in the budget bill, we'll be back in person for meetings in August. So it'll be good to see you all and see everyone then. Now, through the advocacy of the legislature, the 2% Medicaid rate increase will be going forward, which will assist providers with the wages they can provide our direct support professionals. The county board system looks like they'll be able to assist as well. And we continue to attempt to assist mitigating the workforce crisis that we're seeing. There's just not there's not just a DSP crisis, but a workforce crisis, which we can see in almost every industry in all of our everyday lives. And finally, Jen, I do want to thank you again, and we look forward to working with you. That concludes the president's report, and we move on to the superintendent's report.
You think I would have this down after 12 months? I've been constantly muted. I mean, I was talking about Frances and said wonderful things about her, but no one heard it. So I'm going to try again. Great to see everyone this afternoon. So glad you're here. For the superintendent report tonight, I do want to share two documents. One is a new document, which will become part of the fabric of our board report going forward. And the second report is something that we share every 6 months, which provides an update on the goals in which we set every year. So what we're measuring, this is a product of our strategic plan. This is one of the goals, is just to be more transparent on the people we serve and how we do it. So right now we are serving over 4,100 people, and that's the most we have served in our history. And as you can see, hopefully you can see it on your screens, but the number of people we're serving in early intervention, preschool, school age, the eligibility determinations, our children served. And I want to point out specifically that 3 to 13, that number just continues to increase. If the beginning of the year was 383, it's jumped to 446 in May. So that is an area hopefully that we are reaching, and our message is penetrating into school districts, and by our outreach to families, that we are reaching families with children with disabilities earlier. And it also will depict the number of IO waivers and the self waiver and the level 1 waivers. Right now, we have 1,769 people with waivers, and that is a lifelong commitment that we have made to those people. And incidentally, we are the 7th largest county, but we have the 5th most people enrolled on home and community-based services, that is a really testament to our commitment to people with disabilities and their families. Next is our family support services, and those are direct payments we make to families in need. And something that we are attempting to increase is those using supportive technology. With the workforce crisis, we are trying to make more inroads for people that are higher functioning to be able to use remote supports. And it's very sophisticated, so that staff will not have to be with them 24 hours, 7 days a week. Next is the MUIs that we have each month. So this will be part of our kind of just agency outcomes, you know. So if we could scroll to the next page. Every month we, through the Centers for Marketing Research, it's called Seymour, they interview 20 families. And so these are the results on 5 indices. Actually, they test almost 40 indices, but we're just reporting out on these 5. And we found these to be important, but we have access to a lot more data. Inclusive and social activities, we want to track to kind of be a measure of the degree of that people are integrated into our communities. And I want to highlight the number of people employed. We are at 259, and we have actually seen an uptick in the number of people employed in community jobs due to the workforce crisis. Many of the people we serve have worked throughout the pandemic and never missed a day of work. And so they have become reliable employees that businesses can count on. Let's scroll to the next area. These are our provider support activities. We want to keep a close handle on the number of providers. So right now we have 149 agency providers, 171 independent providers. How many compliance reviews we do, RN quality assessments. So this can all be found on this document. It is kind of it is really an overview of many of the board reports. So some of this is going to be in board reports, but it also is in this, what we're measuring and putting out there in the final page, if we could show. And these are effectiveness and efficiency type measures, employee turnover, the number of recordable OSHA injuries we have, the incident rate at the end of the year, targeted case management. That is something that is the productivity standard for our case managers. Help desk tickets for our that are completed through our IT department, work orders completed by our maintenance department, miles between accidents for transportation, and the number of students we have on each bus. So these are all measures that we want to, number one, share with you to illustrate and serve as performance measures going forward. So this is new, and it'll be the cover of all the board reports. So it's kind of a summary of the board reports that you receive. Next, if we can go to our 6-month goal update. Certainly, I'm not going to go over each one, but I want to talk to you generally about this. So every year we establish annual goals for our department heads, and they provide a 6-month update on goals, and then by year's end, it should be accomplished. So some of them are already accomplished, and then when we sit down to do our performance management review, we'll talk about goals that can be added. So it ranges from the Whippledale parking lot. It's scheduled for next week to, or the week of the 6th, to get ground down and relayed, to an HVAC system, to increase Special Olympics, unified sports. It talked about our refresh branding of our communication to incorporate our 2021 through 2023 strategic plan. So there's actually 58 of these goals. It works out to between 3 and 5 goals that department heads are working on, but we just want to be transparent about these goals. We want to show updates. So this is one method that you, the board, can hold me accountable, and it's another way that I can hold department heads accountable. And we work on these goals, developing them either together or they do it independently with their actual departments. So, and we've been doing this for 11 years now, just 6-month update and then an annual update on these goals. So it is really, these specific 58 goals are solely about improving efficiency and effectiveness. So I did want to share them as part of our kind of 6-month review. And that really brings us to the close of the Superintendent's Report. I just want to highlight these 2 documents, and we'll certainly have much board business to go through as we go through the meeting.
Okay, thank you, Bill, and thank you and the staff for working hard on those goals. I know with the pandemic, we were so worried about how things would go, and things have been going very well. And I think I mentioned to you on a phone call a while back that a lot of this comes down to the measures and how well things are going. And, it's proven itself out. So thank you. Yeah.
And what makes this work is the staff and the department heads and just their commitment and dedication to the mission of our agency and service to the 4,100 people we're serving.
Yeah, thank you. Yep. Okay, the
Bill, can I ask a question? Mr.
Absolutely.
President? Bill, what do you attribute the increase in individuals being served? I'm curious because you said it's the highest ever, and I'm wondering if there's a trend, or besides the fact that we just do a great job here in Stark County, but I'm interested on the numbers.
Yeah.
good question.
Yeah, I think it's multifaceted. I think getting the message out from early intervention to preschool to school age, I think it's that population that our message needs to penetrate more, and it's beginning to penetrate. It really is. And that 3 to 13 age group is where we're seeing the increases. We're also seeing increases in our transition age, which is running 14 to 22. And it is really getting to families who we're finding more and more have just really significant needs, and need is driving people coming to us as well. So multifaceted, and but it is really in children where we're seeing the greatest increases.
Thank you. I mean, it really shows the importance of marketing and communications and making sure we're getting the message
Yes.
in the right avenue.
Yeah.
So great job. Thank you.
Yeah, and it's just we're fortunate we have the resources to support. That's yeah. Good question. Thank you, Maria. Okay, committee and department reports are in our board packet. Are there any additions or deletions that need to be made at this time? With none, we don't have any old business or new business, but we do have a presentation this evening. Christine Quickie, our Director of Early Intervention and Nursing Services, will share a presentation highlighting some of the work that's currently taking place within our early intervention program.
Thank you very much. I am going to share my screen real quickly and move you all where I can see you because I like talking to people. So yes, thank you very much. Good evening. I am Kristen Quickie. I am the Director of Early Intervention and Nursing Services here at the board, and it didn't start. I apologize. There we go. Much better. Anyway, so I have the privilege this evening to talk to you all briefly about early intervention. It's a very complex and detailed program, but I'm going to give you just a little taste. And if you ever have any questions, don't ever hesitate to call me. I love to talk about early intervention. So just a quick update. We did move the offices for early intervention from Eastgate to Whippledale in August of 2020. Yes, right smack in the middle of the pandemic. And this is a view of the offices before we moved in. We're right across the workshop floor. So in August, hopefully when we're all back, we'll open them up, and I would love to show off our new space. So what is early intervention? Early intervention is providing services and supports to families so that they can best help their child. So this is part of IDEA, or the Individuals with Disabilities Education Act. So it is a child's right to get services if they have a disability or a delay prior to age 3. And that's what our job is. In Stark County, as in most of Ohio, there are no fee. There's no cost for services for for early intervention. But in Stark County, we're especially blessed. And like Mr. Sutter said, we do have a lot of resources, and we have been very fortunate to be able to provide service to our families at never any cost to them. So what makes a child eligible? A child is eligible if they're between the ages of birth through age 2. They have a diagnosis with a high likelihood of causing a developmental delay, or they have a developmental delay in one or more areas as determined by a play-based assessment, which we call the Bailey 4. And so we do that. Or we as service providers can deem that we see things that are indicative of future delay, and we can do what we call informed clinical opinion. So that's an option too. So when we say we have these teams, this is from a virtual team meeting. We meet every Thursday for about a total of 3.5 to 4 hours per team. Well, total as teams. We have 2 teams in Stark County. We have split the county so that for ease of transportation. But our teams are very complex, and we're so lucky to have the complexity and the composition that we have. Service coordinators are employed by the Educational Service Center, but they live here at the county board with us for collaboration, and it's just been a really good relationship with them. We have EI team leaders, developmental specialists, occupational therapists, physical therapists, speech and language pathologists that are employed by the board that provide services to our kids and our families. Through DODD, grant-funded positions are hearing specialist and vision specialist and early childhood mental health consultant. So our kids that have vision issues or hearing difficulties get services through our teams through a hearing specialist or a vision specialist. So it's a phenomenal collaboration. And they sit on our teams. They come to our team meetings. The early childhood mental health consultant was an addition about 2 years ago, and Mary Beth sits on our teams weekly, and she helps guide us with what we need to help kids with behaviors, help parents troubleshoot different issues, and then she kind of helps to coach us, which has been a huge help. So really what I want us to look at as we're moving forward is what the whole EI team is. Yeah, you saw the cute picture of us, during our team meeting, but the team is the family. Can be parents, grandparents, aunts, uncles, siblings. They're the core nucleus of the team, because our job as an EI team is to have the service coordinator is in charge of the IFSP to write the plan, to determine as a team, to write down what services the team has determined that the child needs. The primary service provider is the team member that is responsible for delivering those services to the family. The whole EI team wraps around this family to help them with services and supports, but it's the family that we are coaching to help their child. And without family, early intervention would not be as successful as it is. So there's a model in Ohio. It's actually kind of spread throughout the country called coaching and teaming. And one of the key principles of early intervention is that children learn best from familiar people in familiar places. So gone are the days when the early interventionist would walk in with their bag of toys and spend an hour with the child once a month, which we thought was fine. But then we started looking at really evidence-based early intervention, really what works. And what works is doing visits where the family lives, plays, and spends their day, a familiar place. Coaching the family to with strategies that they came up with us. We talk about what worked, what didn't. And then the family is supported to integrate those skills into the child's everyday routine. And really our job is to build relationships with the family, but to build their capacity to help their own child. And that's coaching and teaming in a very, very quick summary. So prior to the pandemic, Mr. Green had the vision that he wanted us to have televisits as an option. So we put together a work group early 2019. We started talking about how it would work, how it wouldn't. We talked about roadblocks. We did some site visits, and we're building through IT department this beautiful teleroom with the thought that we were going to do televisits every once in a while as parents needed them. Well, the pandemic hit and we were ready. Starting in March, we had the software on our computers and we immediately went to tele. You can see here, Stacy is doing a visit with a family, and kids, if you think about it, that were born at 6 months have done nothing but tele that are now 2. And I've watched observations where the kids are doing turn taking with the parent and they throw the ball at the TV or at the computer monitor. It's darling because they there's a great integration there. They put necklaces on, they hand blocks to the service provider, so it works. Moving forward, this will be an option. If it's a snow day, if there's illness in the family, but we still want to do the visit, or a parent calls and says, I'm having a terrible day, I just need you to look at, feeding or behaviors, and we can log in that way. It also works great for late visits. If a family's like, I need a 7 o'clock, but that's a really tough time to have a visitor in the home, we can do a quick visit that way as well. So Tela has worked really well for us. So some other quick things that we do, we send out a monthly EI newsletter. Our EI team leaders are phenomenal at putting together about an 8-page newsletter that we send out electronically. And it's got tons of things for kids to do, tons of things for parents to do that play-based, build the capacity for the parent. It always has what we're doing for the play groups that week, or that month, excuse me, so parents can get the supplies they need. We have been virtual. We kept our virtual play groups, which were very successful. And this is a little pumpkin that is doing her texture bunny. It was a sensory activity. So she, I think she was on her her 3rd or 4th bunny that day. She really liked it. But we're really, really, really excited to move to community-based play groups where we're out with the people again. Now that, people are vaccinated and we can be outside, it is going all over Stark County. It's open to the community. This is Michelle, she's a service provider, and she's there with the family, and they're working on skills. They're working on strategies that this family has identified that they need help with. Might be socialization. So we want typicals there to model, but then it gives us an opportunity to observe kids in other environments. This clearly was bubble play day. It's a great shot. So some stats real quick, and I'm sorry, Bill had a lot of stats, but quickly, we serve an average of 600 families a year. That's unduplicated. Families come in and out. So these are families that we see at least once, if not multiple times. At any time, we have 450 kids on our caseload. The number that we report through the board report is the number of kids with actual valid IFSPs, called the kids we currently are serving. But we have about 130 to 150 kids that we are working through the evaluation process with for eligibility. So that takes time. Our service providers are phenomenal, and they do about 500 or over 500 visits a month with people, with families. Tele, in person is absolutely increasing, and honestly, they're ecstatic to be going back into the homes. They felt that they learned a lot about coaching because they couldn't touch the child. They had to use their voice and their interviewing techniques, but they really are so excited to get back out with families in their homes. One of our outcomes that we look at for early intervention are the number of kids that exit in a year and how many of them then need Part B services or need to have services in school. We think it's fantastic that 123 of our kids that exited went mainstream to public school to get their services. That has them with their peers, and we think that's great. There are 5 kids that currently still need Stark DD programs, and that's what we're here for. And, obviously our goal is to continue to work and get them in their local school district. So I will end really quickly. We talked earlier about children learn best from familiar people in familiar places. And this is a neuroscientist who was doing a study on how her child's brain would light up in different environments. And it's called neuroplasticity, and everyone knows that's my big thing this year. I think that it's fascinating that we really believe now children can continue to learn for many, many years, even past 6 years of age. And so if I had been talking to this child, one little spot might have lit up, even if he was moderately familiar with me. But when mommy, daddy, grandma, grandpa, big brother, big sister talk to a child and teach a child, this is what you get. And this is why we do early intervention, to help our families, to build capacity so that they can help their own family. So are there any questions? I don't know, Bill, I forgot to set my timer. I do.
This was really, really informative. Thank you. Just so impressive, and especially your last slide just really tells the story. So well done. Thank you.
Thank you. thank you for allowing me to talk. It really is a phenomenal program, really is. And the people that do it are phenomenal people too as well. So
I mean, it just shows the importance of getting to kids as soon as possible.
Mhm.
It totally changes.
It
their
really does.
future. Yeah,
Yep.
it really does.
Well put. So thank you.
Yeah, thank you, Christine. That was the excellent presentation and very informative. I appreciate that. Okay, now we'll have a review of policies slated for first readings, and Bill Green will present the policies.
Good evening again. So we have 10 policies for first reading. Medicaid due process is statutorily driven. The one thing that we wanted to add to the policy is the ability for an informal county board conference. Anytime that this is requested, we just wanted to make sure that it was explicitly stated. Of course, we have always offered that, but we want to make sure it is in our policy and procedure. Our telecommuting policy obviously has gotten much scrutiny and much input. We did have a subcommittee that was chaired by Connie Poulton and had interested parties that are employees on it. We looked at it very, very hard, and the recommendation, which is in the policy, is that dedicated positions such as SSA, early intervention, provider compliance, RNQA, investigative services that do most of their work, almost all of their work in the community, they would have a requirement to be in the office 20% of the time. So that works out to be 8 hours. The way we monitor that is by targeted case management for our case managers, our SSAs. In early intervention, it's a little different, but you can tell just by the 500 visits that we do each month that they're not in the office anyway. So that was the recommendation of the committee and has been incorporated into our policy. Leaves of absence, that it was reviewed with no changes. Disability separation reviewed with no changes, and we follow the statutory Ohio Revised Code. Our policy models the statute. Access, duplication, and dissemination of personnel records. We have set standards for access to personnel records. There's tuition reimbursement. Our policy was reviewed and it did not change. Nepotism, our policy was reviewed with no changes. Third-party access and virtual private network, our IT policies, and they were reviewed with no changes. I do want to comment on our policies. They do really make up the skeleton of our agency. So if you wonder on a major topic, we likely have a policy and procedure on how we address it. So this really provides boundaries for employees and our stakeholders, and it also ensures redundancies. So that's why we review them every 3 months or every 3 years to make sure that they are still meeting the needs of the agency, the needs of the people we serve, the needs of family, and the needs of our employees. So those are our first reading policies this month.
Okay, thank you, Bill. And now we go through our resolutions, starting off with Resolution 062221. Approves the board expenditures for May 2021. I need a motion.
Hagee moves.
And a second.
Anderson seconds.
Discussion from Lee.
Good evening, everyone. So we had total local revenues during the month of 3.09 million. We did receive our first half real estate rollbacks from the state. Our total state revenues of 209,000 and total federal revenues of 262,000, giving us total for the month of 3.6 million. The only thing I'll note about the year-to-dates are the cost report settlement that we did receive this year that we did not receive in 2020. We've also seen an increase in our real estate tax distribution, which we'll talk about later when we look at the budget, but we've been seeing that for the past few years as well. We had 2 payrolls during the month of 1.2 million. Nothing really special to note out of either of those payrolls. Total benefits paid of 651,000. Total other expenses of 5.6 million. We did pay a waiver match fee along with a provider one-time payment that was approved of about 1.7 million, giving us total expenses of the month of 7.5 million. Looking at our cash, our ending cash balance at the end of May was 65.3 million. If we look at the beginning of the year, we started with 52.4 million. We currently have 11.6 million in 2021 open purchase orders. We've closed 744,000 in 2020 POs, adding in our positive net financial position of 11.7 million. And as you can see, we now have this reserve balance of $10 million, which reduces our unencumbered cash balance as that money is reserved for future operating expenses. So now our unencumbered cash at the end of May is 43.23 million. Looking at our budget versus actual, year to date, 34.2 million in revenue, which is 67% of what we've expected to receive so far this year. 22.5 million, which is 42.5%. Our target's around 42%, but I expect that to fall off as we get through the end of the year since we just had a Medicaid match payment. And then looking at our available budget, mostly made up of personnel, total available budget at the end of May of 18.7 million. 2020 purchase orders carried over in the amount of 1.14 million. Year to date, we've paid 255,000 from those 2020 POs. We've canceled 744,000, and we still have remaining 142,000 at the end of May, which is mainly made up of a provider purchase order that's open for locally funded individuals that I leave open until about the end of June. Looking at our resolution 06/22/21. Again, you see the 2 payrolls here totaling 1.21 million. We didn't have anything really paid out of either of those payrolls. And then the week by week breakdown, you can see we paid our waiver match payment in that first week of May. So if there's no questions, requesting approval of resolution 06/22/21.
If there's no further questions, all in favor of the resolution, say aye.
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 Opposed, say nay. No abstentions. Financials for April are approved. Got resolution 06/23/21 approves the 2023 TWI agreement. I need a motion.
Anderson motions.
Second.
Carmelita second.
Thank you. And have discussion from Bill.
Bernie?
Yes, this agreement would be a 3-year agreement with TWI that models really the agreement that is just ending. Some changes, minor changes are involved. We do expect TWI to vacate the Higgins building sometime this year or next. The lease on the Higgins building is ending June 30th, 2022. They are down to leasing just 22 or leasing 6 vehicles from us. So they have requested that we that we bequeath them to them when we are able, once those vehicles reach the value of $2,500. Other than that, we will continue to bill them for vehicle rentals, maintenance and service, and computer rental. So there is the component that we will not exceed $250,000 in utilities, but the utilities for these two buildings are far less than the $250,000 not to exceed amount in the contract. So any questions with this agreement?
With no questions, all in favor of the resolution for the TWI agreement, say aye.
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 Opposed, say nay. Any abstentions? With none, the resolution is approved. And we go to resolution 062421, approving the 2022 preliminary budget. I need a motion.
Anderson will motion.
A second,
Higgy seconds.
and discussion from Lee.
Thank you. So actually going into 2022, we're not going to see a lot of variance, going into this year. The only thing we know that's going to end is that enhanced FMAP we've been paying due to the pandemic. We know that will go away beginning January of 2022. So we'll be paying the regular 37-38% thin waiver match that we have always been paying. We will see for our local, we'll see a little bit increase in excess costs, but otherwise remain flat. And like I mentioned earlier, we'll see an increase in our real estate tax distribution, as we would just expect this to continue as we've seen over the past few years. As far as state and federal goes, there's really nothing to report. We expect that to remain flat going forward. Our expenses, we've seen about a 4% increase in our health insurance premiums. And also the wages, of course, will increase based upon contract negotiations, staff increases expected to go forward. And then, of course, $1 million increase for issuance of new waivers each year. Again, our revenues are going to remain flat from 2021, except for the real estate taxes, and expenses, again, expected to remain flat given besides the health insurance and employee rate increases. So here's a quick chart of our cash balance. And we've seen this before where we get into 2022, 23, and then we see the cash balance start going down. Right now, our waiver match is about 40% of our budget. And of course, that's just going to keep going up as we issue new waivers. Our revenue is expected to remain flat, given the small increments of that real estate, but that issuance of new waivers is really what our mandated function is. And so we'll start to see that cash balance dwindle through 2025. Now let me share the resolution with you real quick. Are there any questions before I share the resolution?
No.
Okay. All right. So here we have resolution 62421. You can see we got 36.8 million for our real estate tax, and I budget, just around a 2 or 3% increases. That's what historical data has shown us. So total local revenues budgeted of 39.4 million. We have total state revenues expected to remain flat of 2.8 million, total federal of 7.1. I'm not expecting a cost report settlement in 2022 since we just received 2 this year. So total revenues of 49.4 million. And then of course our expenditures, nothing really to note other than our waiver match, which is expected to go back to normal because we're not paying that enhanced rate anymore. So total expenses of 56.01 million, giving us expenses over revenues of 6.6 million. And then of course, taking into consideration the $10 million we take up for that reserve account, expecting to end the year with 39.5 million at the end of 2022. Our capital fund, we haven't seen any activity there. We still have a cash balance of about 14,000. Same with our Cohen Gifts and Donations Fund, no activity there as well, but we still maintain a cash balance of $125,000. If there are no questions, requesting approval of Resolution 62421.
With no questions, all in favor of the resolution for the preliminary budget, say aye.
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 Opposed, say nay. Any abstentions? With none, the resolution is approved. Go to resolution 062521, approves the lease with Plain Local Schools. I need a motion
Hickey moves.
and a second.
Anderson seconds.
Thank you. We've got discussion from Lee.
Thank you. So this is just to renew our lease with Plain Local for the period of August to July of 2022, not to exceed $30,000. So this basically covers our Avondale Elementary and Taft Elementary food service, IT, administrative, custodial. I mean, we've had this in place for quite some time. Since the embedded classroom was initiated, we've returned 15 students back to their districts. However, none were returned last year due to a student leaving and moving right at the end of the year. However, we're hopeful, obviously, for the future. And this $30,000 lease is always paid with our Part B IDEA money that's allocated through this grant that we receive every year. If there are no questions, requesting approval of Resolution 62521.
Okay, thank you. All in favor of the resolution, say aye. Aye.
Aye.
Opposed, say nay. Any abstentions?
I abstain.
Okay, thank you. And the resolution is approved. So moving to resolution 062621, approved request to purchase computers, which is a computer refresh. I need a motion.
Anderson
Hickey
motions.
moves. Hickey
And a sec-
seconds.
Thank you. And discussion from Brandon.
Good evening. You guys hear me okay?
Yes.
All right. IT department is seeking approval to purchase 59 computers, cost not to exceed $103,000 as part of our annual computer refresh. Every year, the IT department replaces aging and out of warranty computers. We refresh around 25% of our computers every year. These computers are all board computers and will not be used to refresh TWI computers. And the purchase is covered by the $140,000 that was appropriated for the computer refresh as part of the IT department's 2021 budget. So if there is no questions, seeking approval for resolution 062621.
Okay, thank you. Any questions? All in favor of the resolution, say aye.
Aye.
Aye. Opposed, say nay. Any abstentions? The resolution is approved. Now we move to second reading board policies that were presented at the May board meeting, and they'll be presented by Bill.
We do have 8 policies for second reading. Cash management, annual inventory and disposition of property, behavior support, workplace violence prevention, professional meeting and conference absence, suspension, removal, and expulsion of students, passwords, and retention. The policy with some changes is the behavior support policy, and there was additional language added to restrictive measures and making sure that we took the least restrictive support measure for any person served. So we just added and tweaked that language. All the other policies were reviewed with either minor changes to the text or no changes at all.
Okay, thank you. That brings us to resolution 062721, providing approval for board policies presented for second reading. I need a motion
Smith motions.
and a second.
Anderson seconds.
With any further discussion? No further discussion. All in favor of the resolution for second readings, say aye.
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 Opposed, say nay. Any abstentions? Board policies are approved. Okay, now I need a motion to adjourn.
Hickey moves.
And a
Anderson will
second.
second.
Okay, all in favor, say aye.
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 Opposed, say nay. Any abstentions? We are now adjourned at 6:57. Everyone have
Have
a
a
very
safe
good.
holiday, everyone.
Bye.
Bye.
Take care.
Thank you. All right.